complain, but this thing's in the game.
What's your name?
Consequence, I'm tight, burnt like flames.
And why's that?
American dream, they got this ghetto kid in the fiend.
Don't stress that, cause it's not in your bloodstream. Your whole being comes from greatness, you remember. Chase on got you caught in the storms of December. And brothers on the block packing nines like September. Change the situation, keep the pockets all slender.
I'm Sasha Nicole.
And I'm Star. And I'm Dr. T.
And this is American Therapy, the definitive podcast on all things Black mental health. And today we have a great show as always. We always say that, but we really do have a great show every time. We really do.
Today we are going to talk about all things ADHD. Is it hype or is it real? Dr. Royce over here like...
I definitely have an opinion on the matter.
Oh, gosh.
Me too.
I have pills in my bag for it, so it's real to me. So before we get in with introducing our guests, just want to make sure you guys follow us at American Therapy with the K on Instagram, as well as subscribe to our YouTube channel. Know that we are still doing our HBCU mental health tour. We have Delaware State coming up. We have Hampton University coming up, and we also are slated to go to Kentucky State University. We're hoping that we get a definitive date for that soon, as well as we're looking at a whole bunch of other schools. So we need you guys to follow our traction and what we're doing. And if you're not already following Dr. T, please make sure you follow her at Dr. T for a Better World on Instagram as well. She has some great talks and insight for you, so make sure you do that and follow all the progress that we are doing. And so without further ado, we have James Lee Jr., MD. And so Dr. James Lee Jr. is an adult psychiatrist in Greenville, South Carolina. He is currently working as an inpatient psychiatrist at Springbrook Behavioral Health in Travelers Rest, South Carolina. Dr. Lee is a graduate of Morehouse College. He received his MD from Meharry Medical College and later completed his psychiatry residency at the University of South Carolina Palmetto Health in Columbia, South Carolina. He later completed a forensic psychiatry fellowship at Tulane University in New Orleans, Louisiana. And prior to his most recent move to Greenville, he served the Rock Hill, South Carolina community as the president CEO of Ascension Behavioral Healthcare for over 10 years. In addition, he worked at the staff psychiatrist at Winthrop University in Rock Hill, South Carolina, and he currently serves as medical director for Standards-Based Solutions, a mental health agency in Chapel Hill, North Carolina. And he is also a founding member and treasurer of Global Health Psychiatry, LLC, a collection of 9 African-American psychiatrists from across the country who have come together to educate others on the importance of addressing mental health in our communities. Global Health Psychiatry has published 2 books, Mind Matters, a research guide to psychiatry for Black communities and how Amari learned to love school again, a story about ADHD. His involvement with Global Health Psychiatry has been a truly fulfilling opportunity as it aligns with Dr. Lee's passion on educating others about mental health and helping to break down the barriers and stigmas associated with this topic. So welcome, Dr. Lee.
Ooh. Good evening. It's a pleasure to join you guys. How is everyone doing?
We're good.
Do you have us on speakerphone by chance?
I do. Do you need me to get off?
We do. We got that feedback going on.
Okay. Let me put on these, let me get you through the headset again. Hold on.
All right. We'll give you a second.
I feel like when he was like, let me take y'all off speaker, he's like, I can see him like, they're like, okay. All right.
Right. Speaker is so convenient. Absolutely. So, Dr. T, you were saying that you have an opinion on ADHD before we even started. What's your opinion?
Well, it's definitely a real disorder. It's definitely genetically transmitted, but it definitely is overdiagnosed in certain populations and underdiagnosed in certain populations. It's definitely overtreated in certain populations and undertreated in certain populations. And so, I had a kid in actually my practice today, and the kid actually had PTSD.
Really?
Their reactions, but they were moving around. They were hyper. They couldn't focus and concentrate, but it was because they had been sexually abused and they didn't have the language. And so they were all over the place. And the teachers were saying, like, you got to do something. And, so everybody says it's ADHD. And so, I said to the mom, like, this isn't going to be as easy to fix as ADHD.
Okay.
But if we treat her, and it was a her, which also that's unusual. We always think of boys. If we treat her for PTSD, in the long run, it's going to be better for her and it's going to be more accurate and she's going to do better,
But immediately the teacher and even a parent, from a relief standpoint, maybe an ADHD diagnosis will, I don't want to say give them the relief, but
I think that's just what people are, it's the one that people talk about the most, right? And even though this mom knew that the child had been traumatized and was currently almost being re-traumatized, that the mother just thought, well, she's hyper, she can't focus, must be ADHD.
I mean, I know that's another show, but for her to know that the child was almost being re-traumatized, I guess my first thought is, well, how the hell
No,
do you know, I mean, that's another topic.
Yeah,
We're going to stay on
yeah,
topic, but
yeah,
just
'cause,
letting
you know,
y'all
it's-
know, we're
yeah.
going to talk about this eventually,
Yeah,
about
yeah,
trauma
yeah.
and molestation and rape. Dr. Lee, can you go into
Yeah.
detail about the work that you're doing, about the book as well, and just everything that you know surrounding ADHD in the African-American community?
Yes, yes. Well, once again, thank you for having me on. What was just said is absolutely right. The reason that you want to get evaluated first and foremost is because ADHD or ADD is a treatable disorder. So we have to keep that in mind. There can be a genetic predisposition for it. It is a real it is a real phenomenon. Now, it is misdiagnosed in some. It is overdiagnosed in others. Now, in the book in our first book, My It Matters, we pretty much took each area of psychiatry, including child and adolescent psychiatry, and broke it down to a very understandable dialogue. It's written in a question and answer format, and we asked just common questions that individuals would ask from, dealing with everything from depression, anxiety, ADHD in kids and adults, PTSD. So we basically broke down the DSM-4 or 5 and hit most of the things that you would see on an outpatient basis. It's written in a very easy format for individuals to understand. It's in a question and answer format. As far as ADHD is concerned, it can be overdiagnosed in some. And some people think that within our community, within the African American community, it's overdiagnosed. Actually, it's probably misdiagnosed and underdiagnosed in our community. What we see is our little black boys, our little black girls getting diagnosed with conduct disorder or oppositional defiant disorder. So, and also to touch on another part that you guys were just speaking of, it's easy. I always say there are two ways of treating an illness, and Dr. Royster can agree with this. You can either treat the symptoms or you can treat the underlying problem.
Okay.
That's true.
Say that again. I'm gonna put my
it
star
again.
hat on.
I'll
Say that
it for the
again.
people
While I'm
in the back.
texting.
Yeah. I'll say it for the people in the back. You can either treat the symptoms or you can treat the actual diagnosis. So most people, of course, are going to see the symptoms. So they see somebody who's wiggling, who doesn't pay attention, who is easily distracted. And, of course, that's the first thing they jump to. Oh, they have ADHD. But a lot of times when I was an outpatient, when I was working at Winthrop at the university, and when I was an outpatient psychiatrist in Rock Hill, I would almost treat ADHD as a rule-out diagnosis, meaning that there may be some other things that could be presenting in the same manner. And if we treat the underlying issue, those symptoms that you see will kind of fall into place and they will kind of correct themselves.
So what is that like? What would that look like? What's an example of, there's some other symptoms that may be showing that people will say, oh, this is ADHD. I know, Dr. Royce, you gave the example of, there was a trauma going on. But then with our black boys and girls and adults, we have experienced trauma, for centuries. And so it's like, how do you distinguish, like when you said rule out, I don't. You said it. I don't know how to repeat it, but you get what
You
I'm
know
saying.
what we're saying.
Well, let me break it down. All right. So let me break it down. So, as Dr. Royster said, she had a young girl who had PTSD. PTSD is under the umbrella of anxiety symptoms. You may have somebody who has an undiagnosed anxiety, and it could be just nothing as serious as a PTSD diagnosis because of the trauma, but you may just have somebody who has racing thoughts, who just, they constantly think about things and they constantly worry about things. And that constant thinking, that constant or excessive worrying leads them to not be able to focus because they're thinking about the next thing that's going to happen and then the next thing that's going to happen. I give an example sometimes. I have had patients tell me that simply driving on a state road, they may come to a stop sign, and in the minute that they stop at that stop sign, they have already gotten in an accident because somebody's going to plow into the back of them. Now they're going to be in the hospital. Now they're going to lose their job because they're out of benefits, and they're going to have all of these finances and bills that they can't pay, and they're going to be homeless.
From a stop sign, for just stopping at a stop sign.
From stopping at a stop sign. So if you want to take it to an environmental level, you may have a kid that isn't eating, who doesn't have breakfast before they get to school, and they're hungry or they're hangry, and they're not paying attention, or they're sleep deprived because mama or daddy has people coming in the house all times of the night, or they hear gunshots and they can't sleep and the kid is tired. You know, they can't focus, they can't concentrate. And we need to, or like you said, they have bad nutrition. So there are a number of things. They may be depressed and can't focus because they're depressed.
That's fair. That's fair.
Yeah. So another way to, or an additional way to think about it is that ADHD is a diagnosis that is met by confirming that the person has a certain number of symptoms that look like hyperactivity or inattention. But there is also a criteria that says this behavior is not better explained by some other diagnosis. And most people just skip right over that part. If you meet the things on the checklist, they're like, you have ADHD. If you don't do the really thorough history and understanding of what's going on with that person, you could miss some other reason, clinical, environmental, social, that might explain these symptoms as well. And so then that's when we get into the misdiagnosis part, because then they have a reason why they're not focusing and why they're hyper. And we're not treating that reason, as Dr. Lee said, we're just treating the symptoms. And so that's kind of, I think if you think about it, if you just check off the symptoms, a lot of people on any given day could meet those symptoms. Of course, they should persist over time if you're going to give someone a diagnosis. But if you don't dig a little deeper and say, well, what else is going on in this person's life? What else is happening in the family, in the community, in the school, that could also be contributing to why this person is behaving this way.
So could, for parents out there specifically, or even adults, you know, like, should we be cautious of a diagnosis that is prior to talk therapy, or like how, because, you know, I've had friends that they're like, oh, my daughter has ADHD, and it's off of one visit, off of one, you know, school psychologist visit to then, you know, external visit. Is that really enough if there's this caveat there of that, there, you know, should there not be anything else? Do you need to have that, like multiple sessions?
I mean, if you do a good assessment, you can do a good assessment in one session.
In one session,
right?
Okay.
But that's the question is, did the person do a good assessment?
Okay.
And so and the checklists are helpful, but they're not the only thing.
I got you.
And so parents ask me that all the time, like, well, they didn't have any testing. There is no testing for ADHD or any other psychiatric disorders or most medical illnesses in general. But we have to use our best clinical judgment, which includes a thorough history and a thorough understanding of the person, their life, their stressors. We call the biopsychosocial approach. What's their biology? What's their psychology? And what's the social issues that are...
So, like, as a layperson, as a parent, how would I know if, like, this assessment feels like it's a good assessment or it doesn't? Given, you know, we won't have that clinical background.
Yeah. So did you feel like you had a chance to tell the story, right? Or did you just answer a bunch of yes and no questions, right? Did you talk about what your concerns are? Did you talk about where you think it's coming from? You could Google. There's tons of different examples of what a full assessment looks like. But really, the biggest question is, did you feel like you could tell your story?
Okay.
And that includes, though, where you come from, what's been going on in your life, and sometimes parents, but most of the time, I find that parents want to do whatever they can to help their child, and so they're willing to tell the whole story. And the same thing goes when they're adults. There are many times when people have struggled throughout their whole childhood, their early adulthood, and they find out later in life that they have ADHD, and they just always thought they were stupid, or they just always thought they, needed to try harder, or they always thought that there was something wrong with them, and it just that they had never been diagnosed and treated.
So when you go back a minute, and when you say there's no real testing, so for me with my daughter, and the issues that we were having with her attention, with her just a variety of different things I can go through. But to make a long story short, we took her to a specialist. It was very hard to find anyone who would do any type of assessment, or as I'm saying, testing, and I'll get to the point for you to clarify, who would even accept insurance. Most of the time it was in excess of $5,000 or more just to even do a full assessment.
You said 5,000
or more.
5,000.
like U.S. dollars, not
Yes,
Wakanda
or more.
dollars.
And so in this
Pesos.
right in the area that we're in, like for the places like the Kennedy Kriegers and stuff like that, but they would take insurance, but for the outside ones, but there also was over a year waiting
Yeah, I
list.
was
My
about
daughter
to
was
say.
on the waiting list for Johns Hopkins for over a year.
A year.
Over a year, and we just got called into Johns Hopkins a few months ago. And so so I say that is that we went into this assessment, and they had her for a few hours, and they did, I don't know, I thought it was a test. So is it not? Is it not? I thought that they were quote unquote testing her because I used this to get her a 504 plan. So is it, for the parents like myself who obviously are ill informed, is it not a test? Like, what are they looking at?
That's a great question.
No, it is.
Well-
Go ahead, Dr. Lee.
Well, all I was going to say was there isn't a specific test, and a lot of times when people ask for tests, they're talking about a brain scan or some type of blood test for like psychiatric disorders. And there is no blood test to tell whether you have ADHD or depression or bipolar disorder. As Doc can tell you, they do assessments, and they can do assessments. And the thing about these assessments is that they have to be done or at least looked at in several different areas, meaning at home and at school, or at home, at work, or at school. It's not just in one place. So when we go through and we talk about the symptoms of ADHD, it's not just something that just happens at school and everything else at home is, peaches and cream.
Well,
Their
what the hell
problem
did
that-
they do? Because she got a form that the teacher had to fill out, and then I had to fill out,
Right.
and then this
Right.
tester, this other psychiatrist,
Psychologist, yeah.
he did this testing with her for a few hours. So as a
Right.
parent, I come to this place like,
Feeling like you paid for something good.
yeah, my kid
I
is
would've
my kid is
So-
acting this way. Tell me what the hell is wrong
Right.
with her.
So these tests that you're talking about are essentially what we've been saying. They are list of questions, and the way that the child responds to the questions. You look at all the other thousands of children that have taken this same test, and it basically tells you the odds.
Dr.
of
Lee,
this-
what the hell are you doing?
He done fell out of the chair.
It tells you the odds of a child who answers the questions in this way having certain problems, yes or no. But there is no test that definitively says, yes, if you answer these questions this way, you have ADHD. It says the probability.
But what about like they measured she had certain numbers that came back.
They had a
and like they
scorecard.
made her do exercise.
Yeah, so,
we'll do the scorecard. It was
Yes.
a scorecard,
Yeah,
Star.
I know, they build. It's billable hours.
that sounds like she had a very thorough neuropsychological battery, which is basically measuring how different parts of the brain are working.
Okay.
So the part of the brain that recognizes numbers is it functioning properly? So they
Oh,
give it a
wow.
bunch of tests that are specifically targeted for just that part of the brain.
Wow.
The part of the brain that can separate and distract. When you there'll be a test that has the word red, but it's in the color blue.
Okay.
And they'll ask you, what does the word say? And people want to say blue because the color is blue,
right.
but the word is actually red, right? So it's testing your ability to differentiate and separate out information quickly. So there's a lot of different tests like this. And so they measure how different parts of the brain are working. And then you can take all of those information and say, okay, a person who falls in this pattern is likely to have an anxiety disorder. A person who falls in this pattern is likely to have ADHD. A person who falls in this pattern is, and it also can tell you, well, this person has dyslexia, or this person has a math disorder. So there's thousands of tests in this neuropsychological arena, and you can pay, as you said, a pretty penny, and it's very hard to get insurance to pay for it.
Absolutely.
Right.
Because it's so variable. So you say you're going for a full battery, and the next kid goes and they get completely different set of tests, because it should be customized to what the question is.
Ooh, then that's tricky though, because if it's varied based on a question, maybe I'm not asking the right question.
Absolutely, yeah.
So then, Dr. Lee, when
Yes.
and tell me in regards with the book, with
Yes.
with my daughter, when it came back and they said it looks as though, and I'm going to say looks as though because now I'm using the right language. It looks as though she has clinical ADHD, but then they said that the child has anxiety and depression. Now my daughter, who is 7, I'm like, what the fuck she got depression for?
Really?
Because I'm like, what do you have to be sad about? As says she get everything in the world, and so the question for me would be, is it possible now, mind you, that is it possible the way that a mother carries the child in the womb?
Ooh, is it
the other,
hereditary?
I've have some, when we first went to a psychologist to just even talk about it, the psychologist informed me that, as you mentioned, that it could be genetically transferred down. I suffer from a great deal of anxiety and depression, along with ADHD. And so I never knew that it was genetic because I just thought that, I don't know, I guess I thought it was something that you develop or whatever. And so what are some of the things that, as people in general, but then as parents, is that trauma, was there I had a horrible pregnancy. Could that trauma have transferred into
Could you give
her?
it to
Yeah,
her?
from a depression standpoint, to be so young. And
I mean, if you smoke cigarettes, you give it to your baby.
I don't know. Yeah. So talk to us about that, and then tie in on the measure of the book with the Loving School Again.
Okay. So as far as young kids, as your child at the age of 6 or 7 or 7 or 8, possibly showing some signs of depression and anxiety, I'm not as familiar with the research to say what traumas in utero while you're carrying the baby may contribute to that, but definitely, if in fact there is a history of anxiety or depression, they can start to show those particular symptoms as early as 6 or 7.
Wow.
It can be a social anxiety about going to school, and it may just take one small, and things are a lot different now. I think all of us are close or around about the same age.
They younger than us, Dr. Lee.
I'm 40.
Oh, they're younger. Okay. All right.
Hey, I'm 40.
I'm in
I
my
look
30s.
good. I look damn good for 40. I've been drinking water.
Well, there are a lot of stressors and contributing factors now with social media and having to keep up, and the 24-hour cycle as far as YouTube and everything. All of that can contribute to a child's persona and psyche. And with the increase in bullying, it's funny because I heard somebody say the other day, when we were growing up, bullying was a place. I'm going to fight you here. Yes. We're going to do this here. Yes. We're going to do this here.
And that's it.
And you had to learn how to Joan, too. It was like a badge of honor. Like, oh, you making fun of me? I'm going to make fun of you and your mama.
Yeah, that's right.
But now it is 24/7 because they have access to you through everything.
Mm-hmm.
So,
Mm.
okay, I kind of got off there. So the 7-year-old can show symptoms this early of anxiety, and it could be, like you said, not wanting to go to school, not wanting to go out in public, the racing thoughts that I was talking about earlier, being overly concerned about mommy or daddy and thinking about death a lot, not necessarily thinking about suicide, but fearing the unknown. We'll say that, fearing the unknown. So those things can show this early.
But where does it derive for you? Go ahead.
Well,
Scott.
I mean, like, so the one thing that's scary, not scary, I don't want to use fear language, but like, so my family has a history of depression. I found out, like, happenstance later in life that, like, multiple family members had gone through like serious depressions. After, I'm like, you could have let me know that. Like, I wouldn't have been out here living crazy for so long. And then, but this is the thing that scares me in a way, because I noticed some of that in some younger family members. And now I'm like, well, is there a way you can break that curse? And I hate to say curse, but that you can break that, because, I've gone through my own, struggles with anxiety and depression, which was heavily undiagnosed anxiety and not knowing how to manage it. So is there, or am I just going to guarantee that, our lineage just has that as an issue, or can it be fixed so it doesn't come to your kids?
Well, I'm going to tell you the easiest way to help this is to go to Amazon and get our book, Mind Matters.
Now, you know what?
You better plug it in.
You know what?
Shameless plug. But no, serious talk. This is where our work with Global Health Psychiatry is so fulfilling and rewarding. Because for so many, now I'm going to get on my soapbox, because for so many years.
Well, make sure you're being still while you get on this soapbox.
I know, it feels like you're unsturdy. Like you're like, ah.
For so many years, mental health has been taboo and we don't talk about it. And it's just as important to talk about the mental health history as it is a cardiac history or a history of cancer, because we know all of those things have genetic predispositions. So it's just as important to know that if you have 2 or 3 generations of, now 2 or 3 generations or 2 generations of heart disease in your family, then you need to know that, once you get probably about 40 or so, you need to be exercising and doing some of the healthier, taking a healthier diet and preparing for that and putting yourself in the best practice. It's no different from your mental health history. So we need to know, did grandmama suffer from anxiety? Did grandmama have depression? Or was there a history of PTSD or bipolar disorder or schizophrenia? We need to know.
How do I have that conversation with my family? Because, like, it just came out in my family. Like, literally, when I got diagnosed and I was talking to, my family and my grandmother and my mother specifically, and, like, first they was like, you ain't nothing wrong with you. And then my grandmother was like, well, your grandfather, he would have bouts where he couldn't get out of bed for, like, 3 months at a time. And I would have to, make up something and cover for him. I was like, yo, you didn't want to tell me that? Like, you over here telling me I ain't got nothing wrong with me, but then clearly this is like something that has, been in our family. And now that I got diagnosed, I could see it in myself, my cousins, like, I could see that all of us were kind of struggling with like similar, levels of issue around like this anxiety thing. So, like, how do I have that conversation? Because it accidentally came out. Like, I know she didn't intend to probably ever say that.
Well, I would just say it's almost just as simple as you have to make a point. I mean, you have to sit them down and start doing that fact-finding mission. It's no different than going through that family tree and finding out, if somebody's searching for a relative or whatever. You just have to have those conversations and, using your podcast, using other resources that we have at our disposal now that we didn't have 5-10 years ago, using that as as your motivating factor, and using that to help get this information out in the open.
And you can incorporate it into, do it at a holiday time. Everybody has just eaten Thanksgiving
Definitely.
dinner, and so everybody's there, and you're laughing and talking, and then you say, what? I never knew about this, and can somebody tell me about that? And it's to start sharing the family stories, and then you can be more intentional about digging into areas that you guys may not have talked about in the past. And it's not just mental health disorders. We don't know our history about anything in our families because we don't have these conversations. So we can start it in the mental health arena. But every time I do an assessment, I ask, and I ask it this way. So who in the family has, with just the assumption that somebody has it, right?
That's a good way.
Because if you do it the other way, then they have to fess up. Right. So the way I'm asking the question just normalizes it. There's somebody in the family. If this baby is here,
somebody got it.
Somebody probably got it, because more times than not, the younger a person presents, the more they have a genetic load for it.
But then how do like when Star said, I'm starting to notice certain things within my younger cousins, my grandmother, my grandfather, certain things like that. At what point, if it's just transcending down and down and down, like, is there ever any, cure? Is there ever any point where it's like, is it possible that this is just always a I was going to say some dumb word that didn't exist. Is this some just transcendation of mind to mind to mind? Or is there a possibility, does this just develop from someone who just, acquires this? Because, like my sister, who is a schizophrenic, my aunt who has, she also, I believe, is schizophrenic and bipolar. And so it's just kind of like, so are none of our children safe for all of these? You know what I'm saying?
So it's I guess a tough question, catch-22. There is a combination of nature. No, we're not safe. Okay. I mean, but it's a combination of nature and nurture, right? So we have the genes that we were all born with that have been handed down from generation to generation, and the likelihood that our kids are vulnerable, and that's the key word, vulnerable to the same things that have been passed down in generations is very high. But there are protective factors, things that we can do to minimize the chance that they will express those genes or that they will express them as strongly. Okay. Right? So there are protective factors like taking care of yourself, like making sure that they sleep well, making sure that they're loved, and making sure that, all the things that we do for our children. So there are things that we can do to reduce the risk, but you have the genes, and sometimes, it doesn't show up in this generation. And then that's why it's important to talk about it, because if nobody talks about it, if it by some chance skips a generation and then the next generation has these problems, they're really confused. Yeah. Because they don't know where it came from, or it was on your aunt's side, but then the uncle's kids are the ones that got it. And so it's important to know that they do run in family. There are genetics, but it's just like heart disease runs in families. But we know that we can reduce our risk and we can reduce the impact. And even if it does affect us, there are things we can do to bounce back quicker.
So Dr. Lee, I have a twofold question. So one for adults and one for children. As an adult, as an example, I've been up for over 24 hours. I tried to go to bed last night. I'm not even trying to be funny. I tried to go to bed. No, I'm very serious.
You was up for 24 hours?
I've been up for over 24 hours. I tried to go to bed last night, and I just kept thinking. I mean, so when you said at a stop sign, blah, 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 sometimes that's me because I've been rear-ended a few times. So when I'm driving and I see someone getting too close, I literally, I hold the thing in my car, and I have these visions of going through a green light and somebody running a red light and smashing my car. And so anyway, long story short, I was in the bed. I'm trying to go to sleep. I've, for the past few days been taking Z-Quil to try to go to sleep because I can't go to sleep. And so I'm just thinking, I'm thinking about everything. I mean, from writing a book to the show to work. I mean, I'm thinking about to whoever, I'm thinking about it, right? And so then I'm like, well, let me just close my eyes. Let me just try to stop thinking. And, is the point where an adult would say, maybe I have a problem, or what do I do about it? Who do I talk to? Does this mean I have to go to a psychiatrist? Does this mean, because I go to therapy, but do I need to go to a psychiatrist? Does this mean that I need to talk to them about, like, my primary care gave me Concerta as well as Xanax. I haven't tried the Xanax yet because in my mind I'm like, I don't know what that's gonna feel like, so I've been a little scared.
Right.
But like, do I need to like now go to an actual psychiatrist to talk about, hey, these are the things I'm experiencing, what does this mean? Like, so for an adult, what are the things that we should do, look out for, or recognize that, hey, maybe I need to go talk to somebody, there is a problem, or maybe I just be thinking a lot, like I'm just analytical, because some people will say, I don't got no problem, I'm just analytical. And then the second fold question, and obviously Dr. T tag team, is for a parent who has a child who, it's like, what are some of the things that we should look out for within our children to see, that they're exhibiting something, but then not ignore it, because to my, honesty, there were moments where I felt like, well, how the hell could my daughter even have any type of depression, given that she ain't even lived no damn life yet? What is she depressed about? Like, so what are some of the things that we could pay attention to say, hey, these are some things that I'm noticing both in adults and both in children?
Okay. So, yeah, with the anxiety aspect, so one thing we have to realize is that anxiety in itself is a natural reaction to stress. So anxiety isn't always bad. You said that you have been in a couple car accidents or you've been rear-ended. So it almost is an expected or natural response that you are a little heightened, or you have some heightened awareness whenever you're driving, because this shit has happened to you before.
Exactly. That's true.
Okay?
That's true.
So the easy answer to your question, and then I'll break it down, is at what point do you seek help? Whenever the symptoms lead to an impairment. So if you're having problems sleeping and it's messing up your entire day and you can't be productive at work because you can't sleep, because you can't turn your brain off, because you're just constantly thinking about everything you did yesterday, and now I got to think about everything that I got to do tomorrow, and I'm just running through all these lists, and I can't just shut this brain off. That's an impairment. So you need to get some assistance.
And that assistance, it could be your therapist. Like maybe you institute a relaxation routine before you go to bed. It doesn't always have to be medication. It could be a variety of things. So you could go to a bunch of people depending on what is going to work for you.
Right. And I was, and definitely. No, you don't have to. Psychiatrist doesn't have to be the first door that you go through. It may be a therapist. It may be a counselor, to learn some relaxation techniques, to learn some deep breathing techniques, to learn how to relax prior to going to bed. A lot of us, we're going through the hustle and bustle of the day. We get ready for bed, get into bed, and you haven't cooled down yet. You haven't allowed your brain to relax in order to go to bed. Now, some individuals, as soon as they hit the pillow, they're gone. And, they don't have any problems.
He could sleep on a rock. As soon as he hit the rock, he just gone.
Right. So
but how much? I'm sorry, but like I'm sitting there thinking, like, how much of that is just where are those ruminating thoughts of, because like I've been in a situation where I had, and that was one of the major things with like my diagnosis, was ruminating thoughts, right? And irrationally ruminating thoughts, right? And one of the things was like, I noticed over several years of therapy, it subsided, reduced drastically, but it wasn't just like an overnight thing. And that's one of the things as a patient, I always say, like, I think sometimes people think therapy and internal work is like, okay, give me a pill, give me a solution. But realistically, like, it took me like a year before I was really like, okay, I felt better in moments, but where I was like, okay, I can live a better lifestyle now because I know how to manage myself and I know more about myself. But it was not like, I'm at month 2 in therapy. It was like year and a half. I'm like, oh, hold up. I haven't been sitting for hours thinking about like everything and why everything is gonna like destroy me or something, and I just realized I was like, oh shoot, okay.
And I gotta be honest, I mean, I have a hard time accepting that there's a possibility that I may need a pill to actually help me. So whether that's an antidepressant, whether that is whatever pill that requires for my thoughts that are going on, the vulnerability of it is I have a hard time. And whether the word is admitting or more so accepting that I may have to do this to help me, because I feel like if I just try harder or if I just try to force my brain to turn off, or if I what can I do to work harder to make it stop? And that's, what goes through my mind when, I have repeatedly over the years, as it's been suggested, as I had really bad postpartum with my daughter, of, hey, let's try antidepressant, which may, and I think I'm speaking correctly, which may in the medical term help with other symptoms that could be going on. And I have had a hard time doing it because I feel like, well, then that means that I'm not capable of doing it on my own.
Right. So it's not, what I would say is medicine should always be, not your first choice. Right. So
Correct.
medicine should always be something, I tell people to think of it like a crutch.
Okay.
Right. So if you break your leg is going to heal. It's going to take time. It's going to, you're going to have to take care of that leg. You're going to have to not put weight on it. Like all of these things, we put a cast on it. But even if you don't do those things, your leg is going to heal. It's just going to be jacked up.
Gotcha.
Right?
Okay.
So a crutch is one of the things that you use to help your leg heal properly. Right? So if you think about medication in that way, your body will, for the vast majority of mild to moderate mental illnesses for sure, will heal itself. Now, if you don't do the right steps, then it might be jacked up healing, right? Okay. And that's where we have people who keep doing bad habits and who keep getting in, the same kind of situations. But we can use, if the healing is not going fast enough, or if it's so much impairment that you can't function in your life, we can use medication as a crutch to help you while you heal. But you have to do the healing, and that means you need to do some work. So the people who just want to take a pill, I always tell them this is not a quick fix. Your brain needs to do some readjustment. We have tons of literature that tells us that talk therapy will do the same thing as most medications, but it takes time. And most people don't want to put in that time. It's painful.
So is what I'm also hearing from you that people who are on whatever medication, antidepressant, whatever that may be, that it truly is something that's used to be temporary for someone who's not seen as a severe mental illness. Like my sister has schizophrenia. I think she will need certain help for the rest of her life. Right. But for someone is the things that I'm expressing, and for other people who are listening who may be just like me or have the same situations, or even with Star and the issues that she's dealt with, it's supposed to be used as a temporary measure.
Yes. So I
think that's part, and I'm saying that, and that's because I think that's part of the acceptance part is that a lot of us may not see it as temporary. We see it as though this is something that has to be my forever.
And I think it's absolutely, I think it can be for most people temporary. Now, many of these disorders are cyclical. So if you have depression,
what's cyclical?
Cyclical means
what's that word?
It means that it comes and it goes.
I didn't have thought that. I would have been like sickly.
No, it means that it comes and it goes. So for instance, sometimes we talk about depression around like postpartum. That's one of the times that it can come or go very strongly, right? Cyclical. There you go. That's a new language. But we know that you can get better. And then you can have periods in life for sometimes there's a reason, sometimes there's no reason where it will come back. Yeah. And so it's important to learn to live in between and through the cycles. And that's key. So you can take medication when you get over that cycle, get off the medication. So I tell people we're going to take this medicine until you feel 100% better. And then we're going to stay on it for 9 to 12 months. Yeah. And then we're going to try to take you off.
That's fair. I mean,
right?
I think my
so that because it takes
Yeah.
your brain time to reboot, if you will.
and don't get off of it immediately. Like you will go into
Right.
a hole. You'll be like, oh.
So that's my practice. Other people may try it faster, but I think if you want to reduce the length of the cycles and you want to increase the amount of time in between the cycles, then it's important to treat them appropriately.
Well, goddamn, if I do take it, I'm already be happy and high for no reason. I just be like, oh, I can't imagine what the hell I'm gonna be like if I start taking a pill for every day. I'm gonna be.
Well, like this is the other thing with the medicine. Like what I found, I was in a not a dilemma, but like the psychiatrist puts you on the medicine, and I should say most, but my experience with the psychiatrist is that they don't actually offer talk therapy through your insurance. So then you go to your talk therapist through your insurance. They're two different entities.
And 2 different payments.
Well, I mean, even beyond, they are 2 different copays, but even beyond that, it's like they're not talking to each other. So on one side, you got take this for, XYZ regimen, and then you got your talk therapist who may be telling you continue or let's cycle down.
Yeah.
So like that was the other like, okay, who's telling me the truth?
This could be
Wow,
my
that's
soapbox, but
Uh-oh.
so the insurance company industry is now driving healthcare,
Yes.
and
very
that's
true.
what people really fail to realize and acknowledge. So most psychiatrists have been trained in doing talk therapy. It's not that we're not capable.
I didn't know
of-
that.
Yes, most of us.
I thought psychiatrists just meant you go to this person,
some
meds, because that's what they
No.
do. You go, here's
No.
a prescription, you leave.
15 minutes.
It less
Right.
than that for some
Right.
of them.
Most of us have been trained it's a requirement of our training to be able to do talk therapy. However, the insurance company will not pay for you to get talk therapy from a psychiatrist. So you can get your medicine from a psychiatrist, but they will not pay. Or they will pay the same low rate that they would pay a person who doesn't have the same overhead
Gotcha.
as a doctor. So
Right.
most people, if they want to use their insurance benefits, which they should because they pay good money for their insurance,
Yeah.
right? Most people will have to follow the insurance company's mandate that they get therapists from someone over here and they get medication from the psychiatrist over here. That is driven by the insurance industry.
Wow.
Trust me, most psychiatrists would prefer to do the therapy with their
Can you
patients.
request that your therapist share notes with the psychiatrist?
Yes.
And
Definitely.
can you request that the psychiatrist review them?
Yes. Yes.
Yeah.
Because like my
I don't know.
psychiatrist
I didn't know that.
never even, and he knew I was in like talk therapy. He never even asked for it. He was just like, "How you feeling?" Like literally like that 10 minutes of like, I'm here.
I went to one a few times before. This was years ago, and he literally said the same. How you feeling? And then I was just like, I said, well, blah blah blah. And then he was like, all right. He wrote a script, and then that was it. He never said, well, are you going to a therapist? Are you feeling like nothing?
See
and
you
so
in
I was
2
just
months.
like, yeah, that's what he said. See you in 2 months. And I was like, oh, okay.
And you're like, wow, that was great.
I'm like, because like I had prepped myself
Yeah.
for like, okay, this is the story I'm gonna tell. This is my like narrative of why I'm here. Like, this whole like, which is part of my anxiety. And he was like, okay, like he didn't ask none of that.
So then this would also be a safe measure that we would be able to tell our listeners that if your psychiatrist doesn't do that or you want them to do that, well then you use the analogy, Dr. T, of the shoe or jeans. You got to keep going until you find the person who makes it a priority other than writing you a script. And Dr. Lee, what was you going to say?
Oh, I was just going to echo the same sentiments in that you definitely can have the doctors. You can fill out a release of information form, and then the doctors can have the notes sent over both ways as far as requesting from one doctor and releasing them from the other. So, they can see what the other is doing. One analogy that I like to use, and it doesn't have to be, somebody had mentioned, well, who's telling the truth?
That's
It doesn't have to be all or nothing.
Okay.
The analogy, especially with anxiety disorders, the literature tells us that the best result is actually done when there's a combination of med management and counseling or therapy.
Mm-hmm.
The analogy I love to use is it's just like driving. The medication helps keep you between the white lines, and then the counseling and therapy help you get from point A to point B.
Oh, I like that. I like
So
that.
you have direction. You have control, and then you have direction. So both have their place when you're talking about getting treatment for mental illness.
Mm-hmm.
And what were the tidbits you were going to say in regards to some of the things we should pay attention in our children?
Oh yeah,
Oh yes. So with children, if you notice sharp changes in their behavior where they were very talkative and now they're shut down, they're isolating themselves, they don't have the interest in doing activities and things that kids are going to do. So going outside, playing video games, looking at YouTube, if they're kind of shunning all of that, if you're seeing where they have changes in their personality to where they're real short and argumentative and they're just totally shutting you down and don't want to talk. Those are some of the big things that you'll see initially. The energy level decreasing, the appetites changing, whether they're maybe eating more than they used to or not eating enough, and they're not hungry. All of those are kind of symptoms of depression that you may see in adults and or children. As far as anxiety is concerned, they will kind of, it's funny, kids with anxiety mimic adults with anxiety. You see a lot of them that, worry excessively and worry about things that they have no control about. Some of them may have changes in sleep, but a lot of times it is that constant worrying or being out in public. And even at the age of 7 and 8, as we talked about earlier, they can experience the physical symptoms of anxiety, which we know as panic attacks or anxiety attacks.
Or kids also will complain of headaches or stomach aches a lot.
Yes.
So they may not have full-blown panic attacks, but they may always have a headache or always have a tummy ache.
Definitely.
So what do you guys say about, like, I hear there's like the Dr. Umars of the world, the school psychologists who, I literally just listened to this today, and he's talking about, the ADHD and the overdiagnosis and some of the more, like, I guess, popularized or salacious stuff around, Black children being diagnosed with ADHD. Like, what do you all think about that kind of commentary when, now I came in with a certain perspective of like ADHD isn't real. It's no way they oppress us and, fight the power. But now I'm hearing like, no, this is like a real thing. And if it can be properly diagnosed.
I would say now this is, no shade to anybody who says whatever they say.
I got you.
But I think that those kind of conversations and dialogue keep the stigma of mental health issues going.
Oh.
Because what happens is people then feel like I shouldn't take my kid to a doctor. I shouldn't talk about these things because somebody's going to, those are extremes.
I got you.
Right?
Okay.
Yes, it happens. But as Dr. Lee and I actually both said at the beginning of this, a Black child is much more likely to be underdiagnosed or misdiagnosed than overdiagnosed. But that's not what those kind of popular dialogues, you get a lot of attention, you get a lot of sound bites, you get a lot of media buzz. But the reality is our Black and brown children don't get the help they need.
Okay. That's
much
fair.
more commonly than white children. So they don't get a diagnosis, they get misdiagnosed, they get the wrong medications much more commonly. And even when they get a proper diagnosis, they don't get the treatment. And so when you have those kind of conversations that I think are almost exclusively based in fear and creating fear in parents, then parents are less likely to go out and try to get their kids help. Maybe the point is to try to have them be informed and educated. I would hope that that's the point. But when the conversation isn't balanced, because you've heard both Dr. Lee and I say that some kids get too much medicine, some kids don't get enough medicine,
Yes.
right? So
Right.
the conversation has to be balanced. Yes, there are extremes, but what happens is when you only focus on the extremes, then people think that's the norm and they won't seek help.
Yeah. No, because I literally I had an idea of what I thought of. I was like, okay, I'm ready for the show, and then I'm like, hold up, okay, so this
y'all
is
done
like
messed
a
me
real,
up.
like based on, and not just Dr. Umar, but several others. Like that's a popular topic,
Absolutely,
you know?
yeah.
So, well, y'all changed my mind.
Well,
Okay.
we are, we like sensationalism in our community.
True.
And so
True.
those kind of shows, topics, conversations, they grab people's attention, but they don't really deliver the whole story.
No, I mean, I feel like I feel way better, way more better or properly informed, because I really, and I'm someone with a mental health, diagnosis. So,
And you smart too.
and I'm smart, right? Like, so I know, like, and I've had family members be like, "Oh, you're not depressed. You ain't got no anxiety," and even still in my mind, I'm like, "Oh, see, that's a tactic." So, okay, thank y'all. That was good. Changed my mind.
So, did you not initially believe that ADHD was real?
I don't know, because I watch so much stuff on TV, and there's this whole, like, in my mind, I had this whole thought that there's an agenda against black boys, and which is still true and real.
Yeah.
Well-
And that it was a tool of that agenda in some ways, and maybe kids are being like way overdiagnosed.
Actually, as we said before, there is the argument that there is an agenda, but that agenda isn't necessarily them being overdiagnosed. It's them being part of the big picture and not getting the help that they need, and being underdiagnosed, and then being punished for the behaviors that they're showing. Whereas kids of another persuasion may actually get treatment and help for those same behaviors. So it's the criminalization of mental illness.
Ooh.
Yeah. And then there's also the popular press where in the 90s.
That's a show, Dr. Lee. I'm sorry.
Yeah,
Criminalization of mental health.
Right. In the 90s and the early 2000s, there was a whole lot of press about the high-income white kids getting diagnosed with ADHD so they could get the stimulants and then they could do better on their SATs and their ACTs. And so then the dialogue around ADHD became, we shouldn't give it to kids because they don't really have ADHD, right? They were talking about a small, unique, it was true in a small, unique slice of the population, but that becomes generalized, and these poor black kids, we don't want to make them be overdiagnosed. And so I think that was one of the seeds of black children being underdiagnosed, and again, from the well-meaning white person that throws the whole thing askew, and now we have children that are not getting the help they need, and their trajectories are being changed.
So, Dr. Lee, as we close out, is there any last words that you'd like to add, just from your experience, from the book, anything that you'd want to say? Any words of advice to anyone who may be dealing with ADHD or think that they have a child who may be dealing with ADHD?
Well, for anyone who is dealing with the symptoms of ADHD or has a child that may be exhibiting those symptoms, as Dr. T and I both said, trying to get the help and trying to get evaluated. Those that get evaluated and properly evaluated and treated, it can definitely change the adult's life and or the child's life. Like I said, you can have a child that may exhibit certain symptoms. That child may not get the proper treatment or get any treatment at all. And, the next thing you know, they're getting arrested for X, Y, and Z, and now they're in that pipeline. And we don't want that for our brown and black children. We don't want that.
Right.
You had mentioned the education part of it. I talked about Mind Matters. And you had mentioned the second book. The children's book is actually a book about ADHD and how Amari loved to learn school, or how Amari learned to love school again, a story about ADHD. It's a children's book written on a first grade level, very vibrant illustrations done by a great brother out of Chicago, Tyrus Gaucher. But the important part about this book, the kids can read it and enjoy reading it over and over, but there's a parent guide in the back. That parent guide almost follows the same type of question and answer format that we had in Mind Matters. So we want to entertain the kids but educate the parents.
And that's on Amazon, so we can all go purchase it.
Yes,
Okay.
it is on Amazon. You can go straight to Amazon, or you can go through our website, which is www.ghpsychiatry.org.
I don't know if I even know how to spell psychiatry, but I'm going to look it up on Amazon. I'm like, what?
All right, y'all. So what's y'all takeaway?
I want to just remind people that it is called your healthcare, right? So you have to demand, and it's hard. It's difficult if you need to take someone with you for moral support, but don't let a doctor, a nurse, or anyone tell you something that you haven't had your questions answered. Like, you have to demand that people listen to you, that they talk to
Yes.
you, that they explain to you, that you feel comfortable and confident about your health care, because it is your health. And you can't take care of your health if you don't feel comfortable talking about your health care. And so I really want to encourage people, because we as we've had these conversations over and over, it's people are afraid to talk and ask the questions they need answered. So I want people to demand their health care.
That's
Definitely.
powerful. That's powerful. I think for this one, I'm just going to say, the thing that strikes me about this conversation is that it's a journey, and it's an evolving journey, or what was the word? Cyclical.
Yes.
So there's ups and downs,
Yes.
and there's like challenges, and a maze to get through. But I'm a testimony to working through those challenges of even in the from a financial perspective of like, okay, who's gonna pay for what part or what service, and who can I get a service from, because it's worth the journey. But it is a journey. It is not a month later I'm better, I'm okay. It's like, okay, step 1, step 26, step 126. But that it's a journey, and just keep being persistent about, like you said, your health care. So
I'm glad you brought that up, because a lot of times I tell patients, this ain't a Dr. Phil episode. We're not gonna cure this, or we're not gonna fix this in 30. We're not gonna stop this in 30 minutes or an hour. So I'm glad you mentioned that.
Yeah, we got to keep on going. So I think my takeaway would just be realizing that ADHD in general, there are sometimes underlying symptoms that aren't always getting addressed, and that can help the whole picture. And I think that it's just important for us to pay attention at what's happening, what's going on. And so me saying like, hey, I've been up for over 24 hours, like, there's something wrong. But being okay with addressing that there's something wrong, because it was very hard for me to talk to my primary care and say, hey, I'm having some issues at work where I am unable to focus or unable to complete assignments because I literally cannot stop thinking about a variety of different things. And it's not always bad. And so, because it, again, it's that acceptance piece that there's something wrong. So I would encourage all of us to be okay with acknowledging that there could be something wrong and looking further into that. And so thank you, Dr. Lee, for having us, but thank you.
No.
We thank you for being on our show. And we appreciate
thank you.
I know. Thank you. Thank you so much. And this was great. And we out.